Before applying SeraSeal to a bleeding wound, remove the pooled blood at the wound site by suction or by wiping it away with a surgical sponge. It is essential to see and apply SeraSeal at the point of the origin of the bleed. Apply 1 to 2 drops of SeraSeal directly at the point of origin with a 23-gauge needle syringe. A color shift will occur when hemostasis occurs. The blood will become a cherry red color, similar in color to carbon monoxide poisoning. Do not continue to apply SeraSeal when hemostasis has occurred. An excess of SeraSeal will wash the red blood cells off of the fibrin clot, giving the illusion that the wound is still oozing blood. It is also a waste of SeraSeal. Once bleeding has stopped, leave it alone for 1 to 2 minutes. Do not wipe. It will remove the fibrin clot and reintroduce bleeding. Work in another area during the 1 to 2 minute downtime, then come back and irrigate and suction the treated wound site to look for any hidden bleeds. Wait the 1 to 2 minutes to allow time for the fibrin strands within the fibrin clot to cross-link to create a stronger, tensile strength fibrin clot. Multiple venous bleeds in a wound site. First, remove the pooled blood within the wound site by suction or the use of a surgical sponge. If there are 3 or more venous bleeds within the wound site, using a 23-gauge needle syringe, apply SeraSeal at the base on one side of the wound and gently press down on the syringe plunger to dispense 0.2 to 0.5 ml of SeraSeal, depending on the size of the wound, as you move the syringe from one end to the other end of the wound. This will capture all of the individual bleeds at one time. Leave the treated wound for 1 to 2 minutes while you work in another area. After 1 to 2 minutes, gently irrigate and suction, and avoid accidentally suctioning the clot off the wound. Do not wipe. You may accidentally wipe the fibrin clot off the wound and reintroduce bleeding. If there is a single bleed where SeraSeal did not reach it, apply 1 to 2 drops of SeraSeal directly onto the single bleed, and then follow the previous steps 3 through 5. Obscured venous bleeds. If you are faced with any obscured venous bleed, which you are unable to reach due to obstruction of a muscle or an organ, take the following steps. First, remove all pooled blood from the area to determine where the source of the bleeding is. Second, if the bleeding is seeping under a muscle or an organ, the obstruction, lift the obstruction and insert a 1 cc syringe with a 4 centimeter atomizer attached to the hub of the syringe, and spray 0.5 ml of SeraSeal by sweeping side to side in the general area of the source of the bleed. If the bleeding is seeping behind an obstruction, attach an 11 centimeter atomizer to the hub of a 1 cc syringe and bend the malleable atomizer accordingly to reach behind the obstruction. Spray 0.5 ml of SeraSeal over the general area behind the obstruction. Arterial hemorrhages. There are 3 types of arterial bleeds: a puncture wound, a longitudinal tear or laceration, and a transected artery. It is highly recommended to clamp an arterial bleed whenever possible. However, when a clamp is not possible, follow the following steps. For a puncture wound, first, using your forefinger, apply enough pressure to the artery to slow down the flow of blood escaping from the injured site, but not enough to stop the flow of blood. Cutting off the blood flow, SeraSeal will not be able to create a fibrin clot to seal the wound. Using a 22 or 20 gauge needle syringe, apply SeraSeal at a 60-degree angle with a steady drop-by-drop method until a fibrin clot forms over the puncture site, sealing the wound. Do not apply SeraSeal directly head-on to the flow of the blood escaping from the injured site. It will only blow SeraSeal off from the wound.